Welcome to DrTidy. I am Dr. Kakarlapudi, hospitalist physician and obesity medicine specialist in Fort Worth, Texas. Today I am here to talk to you about obesity medicine and what we do in obesity medicine. So, obesity medicine is basically a specialty that's devoted to taking comprehensive care of patients who are overweight and obese. So, how do we define obesity? Obesity just does not mean that someone is fat or that someone is overweight. Obesity is in fact a chronic, relapsing, multifactorial neurobehavioral disease leading to increase in body fat, which in turn leads to adipose tissue dysfunction, causing adverse health, biomechanical, and psychosocial health consequences. So, seeing how complex the definition of obesity is, one must understand that the treatment of obesity is not instant. Treatment of obesity is always long and long lasting and with several intermediate goals which help in modifying behaviors in order to achieve sustained weight loss. So, that being said, how do we measure obesity? So, there are several different ways to measure obesity, and one of the most common ways is by using body mass index. And how is body mass index calculated? So, we calculate that by dividing the weight in kgs divided by height square, and the height is entered in meters. So basically the unit of BMI is kg per meter square. So according to the guidelines for Indian population, anyone who has a BMI greater than 23 is considered overweight, and anyone with BMI greater than 26 to 27 is considered obese. The second way to measure obesity is through waist circumference, and any male with a waist circumference greater than 35 to 36 inches is considered obese, and any female whose waist circumference is greater than 31 to 32 inches is considered obese. The other way to measure obesity is by body composition analysis, and there are several ways you can do this. One of them is bioimpedance, and there is DEXA scan method is also there, and some patients we can use MRI as well, but it is a costly way of checking body composition. The other ways include air displacement and underwater weighing, which are less commonly used. The most common ones we use are bioimpedance and DEXA scanning to measure directly how much a percentage of the body of a person is fat, how much is protein, and how much is bone. Typically, males who have greater than 25% body fat are considered obese, and females whose body fat is greater than 30 to 32% they are considered obese. So once we measure obesity, how do we go about with managing and assessing patients who are declared to have obesity? Before stepping into that, one has to understand that obesity and several other medical conditions coexist frequently, and obesity definitely makes it hard to control those conditions, and sometimes obesity also leads to those conditions being worse or severe than in people with normal weight. And those conditions include diabetes and hypertension. Both of these conditions are very hard to control in obese individuals. Sugars are definitely higher in obese diabetics than normal weight diabetics, and the same thing goes with blood pressures. The blood pressures are typically higher in people with obesity, and normal weight individuals typically have lower blood pressures than people with obesity. And in addition to that, there are several other conditions including high cholesterol, high triglycerides, hyperlipidemia, cardiovascular disease, stroke, and arthritis and obstructive sleep apnea. These are all illnesses which are more common in obese individuals, and in fact, there are certain cancers, including colon, breast, ovarian cancers, which are more common in which have a higher rate of occurrence in obese individuals than normal weight individuals. Now let us discuss about management of obesity and what we as obesity medicine specialists do. So the first thing is assessing the patient before jumping to treatment. We want to assess and see what weight they are now and what weight they were in the past to assess the rate of weight gain. how fast they gain the weight, whether they had tried any ways of weight loss in the past, and whether they were successful, whether they were unsuccessful. So, understand what they have done in the past and see if we can utilize that in treating the patient right now. And the second thing, of course, is assessing food habits to see whether they eat home cooked food or whether they get food from outside or whether they eat a lot of junk food. So assessing the food habits, getting a food diary from the patient, for asking the patient to write down whatever he eats for about a week time, and checking that in the clinic can help us ensure a general diet history of what the patient eats. And the second thing, and the next thing is physical activity. What kind of job the patient does, whether their lifestyle is sedentary, whether they do any physical activity, if they are participating in physical activity, what kind of physical activity it is, and how much physical activity they are performing per week. It is important to assess that also. And also, one of the most important things that we tend to overlook is sleep pattern. Sleep, obesity, and overweight conditions are closely related. So it's important to get a good history about sleep. If they have uninterrupted sleep, or if they have difficulty falling asleep, or if they have frequent breaks in the middle, or they sleep very less, or if they sleep if they sleep more than the average requirement. So it is important to assess sleep habits also when you are assessing a patient for treating obesity. And the other thing is to look for coexisting conditions which can contribute to weight gain. There are several conditions like thyroid abnormalities and other medical conditions which can predispose someone to weight gain. So it is also important to assess people for other medical conditions while assessing patients for treating obesity. The other important thing is getting a good medication history also, because there are medications which people use for other conditions which can predispose someone to weight gain. So it is important to identify those medications when we are assessing someone who is here to be treated for obesity. Then once this is all done, and once we actually want to jump into actually managing obesity or treating obesity, there are several different ways to do it. I will go briefly over medications that we use. There are several medications that are used, but most of them are controlled substances and they need to be used only under a physician guidance. There are several herbal remedies, but it is important to understand that there's no herbal remedy which has been proven to be effective in reducing weight in the long term. And also, a lot of the times, the herbal supplements which are marketed online or outside, they're usually mixed with drugs that we use for treating obesity, and hence using these would be putting yourself at risk. So always make sure that you let a doctor know whatever herbal supplements you're using. And going into the medications, there are two different classes of medications. One is, most of the medications we use for treatment of obesity are CNS stimulants or anorexiants. What I mean by that term is the medication, when taken, it stimulates your brain to reduce the appetite, the feeling of appetite, and as a result you eat less and you start losing weight. That is basically the mechanism of most of the anorexiant drugs. And then we have other drugs like orlistat, which is a malabsorptive agent. What it does is it inhibits lipase, which is an enzyme which digests fat in your body. What orlistat does is, when you take it along with meals, it prevents dietary fat from being absorbed into your body, therefore achieving weight loss. So all these medications, they are, depending on the individual, they're effective in different ways. And also, when medications are combined with other ways of managing weight, like using diet or lifestyle changes, that can definitely have a different effect as well. So that is a little bit about medications which are used in obesity. And the second one is, of course, which we feel needs to be more important, is the psychotherapy because obesity is not something that happens overnight. So it is a long period of abnormal behaviors or unhealthy eating habits or unhealthy activity habits which eventually lead a person to gain weight, which is causing them to have other health problems. So in order to achieve sustained weight loss, it is important to change the behaviors, adopt healthy eating habits, adopt healthy lifestyle changes, adopt increased activity and all of that. So in order to sustain these, psychotherapy is also equally important. And there are several ways of achieving this. One is self-monitoring, where you can do by using apps on your cell phone, where you can monitor what you're eating, how many calories you're eating, how much activity you're doing per day, and indirectly track how much you're taking so that you can automatically cut down by your own how much you're supposed to eat, and then help in achieving weight loss. The other ways include which we use psychologists help to achieve are cognitive and behavioral therapy. These actually are long-term therapies, which you usually do for a few weeks to months, which help in adapting and changing a person's behavior in order to achieve healthy lifestyle changes. And also the other way which we can do that is by motivational interviewing, where we don't force a change in the patient. We have the patient do everything voluntarily and in a sustainable way, which they are motivated to do. So it is all about achieving, in the end, it is all about having sustained weight loss and following those guidelines and following those habits to achieve a healthier lifestyle. And before going into the next two, the ways of achieving weight loss or achieving loss of obesity is, of course, by the surgical management of obesity. So nowadays there are several surgical options to treat obesity as well. We usually refer, our patients as obesity medicine specialists. We usually refer patients to bariatric surgeons if they are interested in pursuing that option. However, there are strict criteria for persons who, if you want to get bariatric surgery, there are certain criteria, there are certain strict criteria which need to be fulfilled before, before you can go ahead with the surgery. There's usually a psychiatric assessment to make sure that you're not depressed, and there's also, you should have tried other ways of managing your weight, and you should have been unsuccessful at it for a long period of time before considering weight loss surgeries. And also, because of the risks involved with surgery in obese individuals, it is important that we follow these strict criteria in trying to manage patients surgically. So we will not discuss further about surgery as as it is one of the last resort, or as it is one of the options we use if all the other options fail. We'll go further into diet. Diet or dieting is one of the most common ways which people use to achieve weight loss. There are several diets out there: low carb diets, low fat diets. There's a paleo diet, keto diet, Mediterranean diet. And the high protein diet as well. In general, the important thing to think about here is not what diet you follow, but overall reducing portion control, reducing the amount of refined foods that we're eating, and reducing the amount of sugars that you're eating. Is in the ending, what the diets do is encourage you to turn towards this, turn towards using unrefined foods, turn towards using sugarless foods, or turn towards using healthier foods. So in the end, all diets advise this: lower portions and healthier food, and that in turn helps us in achieving weight loss. Overall, the most efficacious diets are the ones which have a higher portion of protein and lesser amount of refined foods in them. That actually helps in weight loss and preventing weight regain as well. So that is a little bit about diet. Actually, before we finish talking about diet, I would also like to talk about meal replacements, which are also used a lot. Meal replacements are basically like a smoothie or a shake, or like a snack bar, which you eat instead of a meal. That's why they call it a meal replacement. And if you're exclusively on meal replacement, that actually we can actually tell how much calories you're eating or how much food you're taking, and that actually helps in maintaining a better log and achieving weight loss as well. It's not 100% necessary to follow meal replacements. You can always use meal replacements. You can always combine that with any diet which you think is working for you. And also the important thing about diets is, make sure you read the nutrition facts label on any food that you're taking. That actually has a lot of information about each type of micronutrient and macronutrient in the food. That is like how much carbohydrate is in there, how much protein is in there, how much fat is in there, how much sodium is in there, how much sugars are in there, how much unsaturated fats are in there. So it gives you all of these information, which actually helps you in understanding what food you're eating, and if you need to make changes, you can understand that by looking at the nutrition facts label on every food that you eat. And going to the next step, which is next way of treating obesity, which is physical activity. You always want to assess if the patient is performing any kind of exercise at home, if they like doing a certain activity. You want to see if if that activity is something they can perform over a long term. Some patients may need to be seen, may need to be assessed for other medical problems which can impede them from being able to perform exercise. Like patients with severe arthritis, obviously they cannot perform activity similar to other patients. So we always want to look for those things too. And when it comes to recommending exercise, we recommend a moderate intensity exercise, at least 150 to 300 minutes for people looking to lose weight. And this should be included along with 2 to 3 days of strength training in order to increase muscle mass and in order to not lose muscle mass, so that you can use the muscle mass in burning more calories and achieving weight loss. Another important caveat I would like to mention here is once you lose the weight, it is also equally important in preventing weight regain, and that is what people lose at most of the time. People easily lose 5 to 10 kilograms in a few weeks time, but once they stop whatever they're doing, whether it is diet or physical activity, they start gaining it back. So it is important to understand that the weight loss journey needs to be a sustained journey. It needs to be a long-term journey to ensure that you lose the weight and you keep that weight away. And one way you can do that through physical activity is by at least, I mentioned earlier that 150 to 300 minutes is necessary for weight loss, but at least 420 to 500 minutes, that is almost 1 to 1.5 hours a day of physical activity, of moderate intensity physical activity. That is what you need to prevent weight from gaining back, to prevent weight regain. So it is important to understand that although losing weight is the eventual goal for a lot of people, what we need to remember is keeping that weight away is also needs to be an important goal. And whatever regimen we choose apart from surgery, whether it's diet, whether it's exercise, whether it's psychotherapy, or whether it is medications, all of these need to be used in a combination with one another. And especially diet and physical activity, you need to choose a diet which you think or which you know that you can eat for a long time. If you're going to do a diet which makes you feel uncomfortable or unpleasant, you cannot sustain that for a long time, and that will not help you. The same thing goes with physical activity. You need to participate in a physical activity which you can do over the long term. Otherwise, you cannot sustain that activity, and you will not be able to achieve the weight loss that you wanted. So it is important to pursue healthy habits which you can do. Pursue healthy habits which motivate you. Pursue healthy habits which you are interested in, to make this a journey, a long-term journey, and help in not only reducing weight, but help in keeping that weight off. Stay healthy, everyone.